Welcome, everyone. So my name is Asta Jureliaviciute. I'm a Senior Coordinator Funding Program Design at Health Research BC. I'm so pleased to welcome you for this session as your facilitator. I'm also calling from my home, Vancouver, which is located on the unceded ancestral and traditional lands of Musqueam, Squamish, and Tsleil-Waututh nations. You're also welcome to put your land acknowledgement in the chat here in the Zoom or in the chat in the virtual platform. Before we begin, a little bit about the format. Each presentation will be 30 minutes long and 15 minutes for the presentation, followed by 15 minutes questions and answer session. As facilitator, I will be monitoring the time closely so that we have about 15-ish minutes for questions. And so the second presentation also starts on time. Thank you in advance to everyone for supporting our timekeeping. And now I'm pleased to introduce our first team who will be presenting co-developing meaningful partnerships and networks for spinal cord injury research with Indigenous peoples. Please welcome Dr. Davina Banner, Richard Peter, and Emily Giroux. Just brief introductions. Dr. Davina Banner is a researcher, lead, and a professor at the University of Northern British Columbia, residing on the ancestral and unceded territory of the Lheidli T'enneh. Through her research, Davina seeks to improve the health of Canadians living with the complex health conditions, along with studying methods and practices that support meaningful co-production in research. Davina has worked in partnership populations that face barriers to engagement in research, actively adopting equity principles and practices. Davina is the sex and gender-based analyst champion of the BC Support Union. Richard Peter is a proud member of the Cowichan tribes of Vancouver Island. He joined Praxis Spinal Cord Institute as the Indigenous Peoples Liaison in 2019. With over 40 years of lived experience with a T10 AISB spinal cord injury, Richard has extensive connections through his long-standing involvement with Indigenous and spinal cord injury communities. As a Paralympic athlete and multi-gold medalist, Richard has successfully represented Canada in multiple sports at multiple events worldwide. He's a member of Canada's Sport Hall of Fame and two-time recipient of the Tom Longboat Award for Indigenous Athletes. He has shared his wealth of experience and knowledge to provide peer support to others living with a spinal cord injury. His lifelong passion is to support and promote the growth of Indigenous awareness, empowerment, and quality of life. As the Indigenous Peoples Liaison, Richard works to enhance collaboration between researchers, healthcare systems, and Indigenous peoples living with a spinal cord injury to improve the quality of life of people in every community provincially, nationally, and globally. And Emily Giroux has earned her master's with Applied Behavior Change Lab, ABC Lab, in 2018. The same year, she was awarded the prestigious MIDEX Award for Outstanding Innovation for graduate student pursuing a master's degree. In 2025, she obtained her PhD and continues to focus on supporting nonprofit disability organizations to be able to authentically and equitably engage in research partnerships. And now, over to our first group of the presenters.
I think I'll start off just with saying, doing a quick acknowledgement too, which thanks Asta for the introductions, and that was great. But yeah, I was just going to reiterate the same and say that I'm calling on also from the lower mainland of Vancouver on the Musqueam, Squamish, and Tsleil-Waututh lands too. And as mentioned, yeah, I'm also a Cowichan tribes member, which is based out of Vancouver Island. So thanks for inviting us to come out and speak to you guys today, and then I'll hand it off to Davina. She can start us off.
Great, thanks, Richard. I just wanted to first and foremost just acknowledge that this work is part of a larger team here, but also to, as well as encouraging everyone to share their land acknowledgements. I'm also down here in beautiful Vancouver right now, so on the beautiful lands of the Coast Salish, Tsleil-Waututh, and Musqueam peoples. My usual home is in Clayton territory, as noted, but encouraging you all to share your acknowledgements. But as well for us, we wanted to take an opportunity to also recognise our team, our many partners, and also the participants of this research. We were very thrilled and fortunate to receive funding through the Michael Smith Health Research BC, various competitions, as well as noting our support from Praxis and others in this work. So I want to start off a little bit with just introducing spinal cord injury, and some of you may have a good knowledge and others not so much. So just a brief background, really to note that in Canada we have around 86,000 people that live with spinal cord injury, and these are injuries that affect the spinal cord, and they result in really quite widespread disruption to the nervous system. And people that sustain an injury have a wide range of health challenges, and that includes some physical challenges such as paralysis and sensory impairments, but also live with a wide range of secondary complications, some of which can be life-threatening, and that can include things like pressure injuries, urinary tract infections, and other sensory issues. And so spinal cord injury in itself is quite a complex condition, and it often requires that people need to use health systems more frequently, so that in terms of our hospitals, but also our emergency and community resources. Spinal cord injury is higher, though, in Indigenous people, in fact, almost 250% higher. So there's a big disparity there in experience of injury. And what we know is that around 40% of all injuries are caused by traumatic causes, and that this is also experienced in the context of other intersecting issues, including the experience of systemic racism across healthcare, but also the impact of other social determinants of health, which can impact people's experience of navigating health systems, and also the resources that they have to support their own health and well-being. And so this work really came from an idea to, and a need to really meaningfully work with people with lived experience, and particularly centralize the experience of Indigenous people living with SCI. And so I was really thrilled to get the opportunity to connect and work with Richard and Emily and this whole team throughout the journey so far. And so our beginnings really came about. I know Richard has been really instrumental in driving work across BC and also Canada and beyond, in terms of really explicitly valuing the voices of people with lived experience, and in particular Indigenous people. And so when we came together as a group, really that idea of centralizing lived experience was something that was first and foremost for us as a team, as well as ensuring that we went about things in the right way. But before we get too far, I'd love for you all to hear more about Richard. And so I'm going to hand over to Richard. He's going to tell us a little bit about his lived experience and then the impetus for the project. And then he'll give us the objectives and purpose.
Thank you, Davina. Oh, there. I haven't seen those photos, so nice photos. Yes, that's a quick snapshot of sort of, I guess, what I've done and what I'm continuing to do. I do want to start with saying that my lived experience is actually very extensive in that I've had my injury. I was in a motor vehicle injury since 1977. So that's where I've had quite a few years of lived experience. I'm getting closer to 50 years lived experience now rather than 40, but that's a bit of sort of when I got injured. So as mentioned earlier, I'm an incomplete para. Grew up on Vancouver Island. And then even just a quick snapshot of sort of who I am and what I've done. You could see I've done a lot of sports. It was great that I got involved into para sports at a young age. And then that sort of opened many doors for me. And I always like to talk about my lived experience in regards to my healthcare and my pathway, my journey. Because I could say that I've had a lot of speed bumps, a lot of barriers that were put in place as an Indigenous young male that's trying to grow up with a disability, living on reserve. And so that's sort of where I started this journey of now working within Praxis. It actually happened with my coworker. He came to my previous job working at GF Strong, the Spinal Cord Injury Rehab Center in Vancouver. And he came and gave his presentation on Praxis and research, and then asked anybody if they had any questions. And it was very quiet. And so I gave him a question since I wanted him to hopefully give me a good answer. But I said, what do they do? What kind of research is done with the Indigenous population living on and off reserve? And if anybody knows my coworker, John Trineski, he likes to talk and has an answer for everything. But at that time, when I gave him that question, he had no reply. And he said, wow, we really don't do anything in that area. And then lo and behold, that's where he came back to me and said, Richard, we want to hire you to do this job. So that's where I sort of said, all right, I should, put my money where my mouth is, or so on, whichever way you want to put it. And I said, all right, maybe I should start working on this in this area. For me, I know there's been many different barriers of living with a disability. And then I can always say the biggest one is funding, with just trying to find any piece of equipment or just, working on quality of life. And I think that's been the biggest thing that I've sort of encountered. And you always figure out ways on try to make that pathway as easy as possible. And so I've always tried to work on that, and I know my journey. And so that's where I was trying to make it a bit easier for anybody that's coming up in the future. So when I did start with Praxis, I asked some input from the other coworkers. I said, can somebody show me any of the studies that have been done previously in regards to Indigenous people with living with spinal cord injury? And I think the number of papers that were on that, I could count on one hand. There aren't many. And so that's where I said, all right, let's try to work on that. And I know it's sort of a big, all right, Richard, go now, start here. But there's so many different areas of where to start. And I think that's where I've gotten help from Davina and Emily and everybody at Praxis to, I always have a few different ideas of where to go. But I'd say one of the biggest things too is I always try to come in and say, yes, I'm thankful that, I've got this platform to come and share and my experiences with everybody here today, but I'm just one voice. And that's the biggest thing that I want to work on is I want to hear other voices in all different communities, not just in BC, but all across Canada, globally. And that's the biggest thing, because I know the barriers that I had living on my reserve and my community are totally different from somebody else in whether it's Prince George or Kelowna, Toronto, New Brunswick. And so I know everybody's got their own separate challenges. And that's one of the biggest things that I just want to try to help everybody understand. And I know even within Praxis, that was sort of the first step, was to now introduce Praxis to Indigenous barriers. One great example that I have is if me and my coworker John got injured on the same day and said, all right, now let's just try to let's say purchase our own first manual chair. If my coworker got injured and he was injured at work and had WorkSafe, then his pathway would be pretty good. That's sort of the gold standard, that he'd be able to get the top wheelchair, probably the quickest equipment, get approved. But me living on reserve in a small community, got injured the same day, then those barriers are, I always like to say that if John was, my coworker, was on WorkSafe, he'd get his new wheelchair within, let's say, 4 months. And then for me to go through that same process, it could take me 8 months, 18 months, or even 2 years to try to finally get that same wheelchair. And just with all that paperwork and red tape and a lot of those challenges, that's what makes that a bit more of a challenge. And I want to try to make sure that pathway is a lot smoother for anybody else that's coming up in the future. And it's been great for me with not just with living with a disability, but about sports. Sports has opened up so many opportunities for me to learn, not just within Canada, but globally. Because even I can now talk a bit more about sports, that with some of those photos that I played wheelchair basketball. And it was great that I'd represent Canada for about 20 years. Been to 5 Paralympics, won, I think, 3 gold medals and 1 silver. So that's been a definite joy for me to be that role model and spokesperson along that area. But then also I like to add that out of those 20 years, I was the only Indigenous person that was on that team also. So that's definitely comes with a few more different barriers along those lines also to sometimes, for me as an Indigenous person, sometimes it is difficult to represent Canada with what is happening, nationally or locally within, my family and communities and all across Canada. But that's always been great that I've gotten a lot of support, from the sport community, but also my family, because I always had a lot of different challenges on those aspects too, with trying to balance both my culture and then also my sport and then also my disability. And so I'm glad that I can hopefully continue to pass on some of those experiences. And so I'm glad that I can come out here and share a bit more today as to what's going on. So for me, like I mentioned, now that I work with Praxis, it's great that, with the help of Davina and many other people that are out there to try to, like I mentioned earlier, to get more voices. Because I know even just access to, even let's say today, of who's got access to get online and connect virtually. In a lot of Indigenous communities, even getting online, a call like this might be a huge challenge. And so that's some of the barriers that I try to talk about with living with a disability and on reserve, whichever community you're coming from. That's always a bit of a big challenge. I'll Emily try to read what we've got here. Yeah, and it's just showcasing a lot of different cultural differences, and also that my experience of what I've gone through with my community and my band is totally different what could happen to, let's say, somebody else up in Prince George, where Davina's from, and I know that there's smaller and different challenges along those lines. So that's why I always want to try to get the voices from each different community to try to find out a lot of those barriers that are out there. It's that's one of the biggest things that I was trying to work with and try to hear all of those voices, because I know there's a lot of people that are still stuck at home and don't have access to, whether it's online. But if I host an event in Vancouver, I know a lot of people can't make it and come down to these events. So I know I sometimes want to get out there and travel to those communities and hear those voices. So the biggest thing is the gatherings, and that was my first concept, that I wanted to try to go to different communities. I'm glad that Davina came out and joined in 3 different gatherings that I've had. I went up to the interior of BC. I went to Kelowna, then went up north to Prince George, and then also one in Vancouver. And so that was great that I could get a few voices that came out. And as usual, sort of what I sort of talked about when I first started, I said it's going to be hard to find those voices. And I think it was a very small amount of number that people came out, but that was one of the challenges. And that's one thing that I wanted to emphasize too. I'm like, this is a perfect example of people not being able to get out and attend these events. So it was great that we could get out there and do that, and hopefully get many more, not just in BC, but across Canada. And it's mainly, just getting more knowledge of what, like I'm lucky that I got a lot of assistance in helping me access care and equipment and sports and work on my health. But I know there's a lot of people in smaller communities that might not know a lot of the information that I do have knowledge of. And so that's the biggest thing of supporting future gatherings and just sharing a bit more knowledge with a lot of different community members and not just specific SCI members, but also health workers, care workers. I'd love to go to every reserve and talk a bit more, even just about equipment of what's accessible to different areas and so on. I think that's sort of, I'm trying to take a look at my notes. I think that's sort of a quick snapshot of sort of what I'm doing and what's going on. And I think I can pass it off to Emily, and she's going to explain a bit more about herself too.
Amazing. Thank you so much, Richard. And I always I always think it's such a privilege for anyone that's learning about this work to really take that time to listen to Richard's story and the connections that he's had and his experiences, because it really just sets the foundation for why the work that we're collectively doing matters and why there's still so much more to do. So I'm going to bring the conversation a little bit back to speaking about the gatherings, but talking more around how these gatherings were framed and shaped. And I think one of the strongest things that we want to allude to is the process of research co-production. And this work and this partnership between Praxis and UNBC is grounded in what are referred to as the Integrated Knowledge Translation Guiding Principles for conducting and disseminating research in partnership. And that is quite a mouthful. So as we move forward, I'm just going to refer to them as the IKT guiding principles. So if we think about different calls from disability communities, not just people living with spinal cord injuries, but other disabilities and other groups worldwide, there has been a consistent call for nothing about us without us, which is essentially if there's going to be research conducted about a population or policies developed about a population, they can't be developed in a way that's siloed from the individuals and the groups and the organizations that represent those who would be directly impacted by the research or directly impacted by policies as they're implemented. So in line with this premise of nothing about us without us, the principles themselves were co-developed by a multidisciplinary team of spinal cord injury researchers, research users, and funders, who are key actors within the research system with the goal of promoting meaningful engagement and combating tokenistic approaches to partnership. So the principles themselves, there are 8 of them in total, and they're designed with breadth and flexibility in mind, allowing any partnership such as ours to adopt strategies as we collectively see fit, in what works for us. So as an example, one principle is ensuring that all partners meaningfully benefit by participating in the partnership. So in this particular case, and we'll talk about it in a little bit, there are outputs of this work that are of value to both the UNBC research team as well as Praxis's Indigenous programming. So with the adoption of these principles, we strive to adopt decolonizing approaches to research by centralizing Indigenous perspectives and ways of knowing and doing, and worldviews that often veer away, or that more often than not veer away from different Western knowledge systems. So as a partnership overall, we are committed to working together to conduct a wide range of research and knowledge translation activities. And I think just for the purposes of time, I'll move on to the next slide. We've talked about the grounding framework of the work that we've done. And I'll talk a little bit more about the learning circles and the gatherings that Richard was speaking about. So the team members, and not everyone's pictured here, but this is a great snapshot of the team, was inclusive of Indigenous and non-Indigenous persons living with spinal cord injury, as well as researchers, trainees, and various members of both Praxis and the National Collaborating Center for Indigenous Health. And we've talked a little bit about some of the gatherings that have already happened across BC, but again, they were designed with the goal of iteratively refining an engagement and research strategies to support the development of a BC-wide Indigenous and SCI network. So directed by Richard, our key research user lead and Indigenous people's liaison at Praxis, he drew from his own indigeneity and lived SCI experience and was absolutely instrumental in facilitating these gatherings. And each gathering was strategically designed with the purpose of creating respectful spaces for building relationships, sharing experiences and resiliences with research, health, and priorities, all with the ultimate goal of supporting Indigenous peoples living with spinal cord injury, both on and off reserve. So just to give a little bit more of context of how we strategized to realize these goals, is we really wanted to prioritize the importance of open and clear communication around the work. And we wanted to ensure that the community that were involved in this work and impacted by this work were deeply engaged in determining the processes of the work as well as the outcomes themselves. And again, we really wanted to ground in this principle of reciprocal relationships and making sure there were clear expectations and outcomes that would benefit every single person involved in this initiative. And we also worked quite hard to provide spaces for people with lived experience and those who work in those settings to share openly. And we were intentional around honoring of protocols and spaces for both Indigenous peoples and people living with spinal cord injuries. So, for example, for our honoring of protocols and spaces for Indigenous peoples, each session was opened with an elder from a local community where available, and every single gathering also included food, refreshments, and travel support and honoraria for people living with spinal cord injury. One thing Richard always says too is that in-person engagement is critical to this work, and we didn't want that to be sacrificed. That was a key priority that needed to be implemented here. And with respect for honoring protocols that support people living with spinal cord injury, we were really intentional in ensuring that the sessions were held in accessible community spaces. So examples being friendship centers and hotels, and we also would take the time to ensure that physical accessibility and cultural safety were in place and everything was good to go for the groups that were participating. And the learning circles themselves, there was a very loose agenda for the activities, and instead we really wanted to prioritize relationship building and authentic engagement. And having a strict agenda sometimes doesn't align with those purposes, and we didn't want to push anyone or anything to say one thing or another. Essentially, we just wanted to create those spaces and build that trust, which would be absolutely necessary for developing a network. Davina, I think I'll pass it to you. And I think you're on mute.
Unmute. Sorry, I couldn't get the button up. Yeah, so just in the interest of time, I'll be very quick and hand back over then to Richard. So through the gatherings, we really did hear quite a range of our stories. And again, really spending time kind of really appreciating that lived experience and learning from each other. We learned a lot as well around, how distinct worldviews and the unique nature of Indigenous communities and how that affects our understandings of health and illness and even disability. And one of the people I want to draw attention to is Dr. Rihanna Robinson, who really had shared, and her own work on disability is so instrumental in understanding this, that often in many Indigenous communities, there isn't a word for disability. People are seen to be unique and have individual gifts through their ways of being and living in the world. And so, even really encompassing that those different worldviews and how we understood the experiences. However, we did hear that people did face quite a number of challenges, particularly as they navigated these, more westernized systems of healthcare, and that often those challenges were intersecting across many different social determinants of health. And so, there were many different barriers to care and health disparities. And I think equipment was a big one. And I know Richard, I think, will touch upon that in a moment. But also there was a need for advocacy. There were complex funding systems, but again, I'll let Richard speak to that because he knows it so much better. But also, different, we needed to tackle issues such as racism and improve that experience of accessing healthcare. And that many people, even in moments where they were really sick, had to advocate very fiercely for themselves, and even countering a position to be believed in their own experiences. And so we heard a great deal about that journey, and as well the need to continue to share knowledge and to build education and supports that centered people with lived experience. So I'll hand over to Richard to say a few more words there.
Thank you, Davina. Yes, and I know we're sort of short on time, but yeah, that's all the gist of it. And it's, that's one of the big challenges that I've experienced. One good example that I did have is actually I got introduced to another peer who was from northern BC. And one of my coworkers said, Richard, I want you to introduce you to this guy. He's just looking for a cushion. So I jumped online and said, oh, sure, let's talk about funding and see what's going on. But within our quick talk about, first, it was just a cushion. But then with that, again, all of the barriers that, that Davina was sort of talking about arose. And that with that talk, then I talked to my coworker afterwards, and I'm like, "Did you hear the other barriers that he experienced?" But as sort of Davina mentioned too, because he was not Indigenous, so he didn't understand what I was hearing, and so that's where I turned it around too, and I knew the Indigenous peer that we're chatting with had racism within his own community that I know he wasn't getting supports from his own band or nation. And then also I talked about, oh, did you go to your nearest hospital with your injury? He had a wound that he had to take care of, and he said because of previous alcohol and drug abuses that were in his past, but his closest hospital wouldn't give him medication or treat him properly because of those issues that was on his medical documents, and so he had negative experiences within the healthcare system again too, and he then had to drive. I think the first hospital was about an hour and a half away, and then he had to drive an extra 2 hours to go to the next closest hospital where he did finally get some care and got some assistance there. And so those were just some of the different issues that do arise there, and some of the different challenges that do arise. And so that's where I try to, it's sometimes hard to explain that, yes, we have the same pathways of living with a disability, but there still are more added barriers that do. At first we were just talking about a cushion, but then that's where I realized that there was a lot more behind that question. And I was glad to, hopefully connect a few more dots and get some healthcare, because it's still quality of life, or even just being given the opportunity to live. And so, yeah, I'm glad that there's a lot more research that is being done in different areas within healthcare and just working with SCI. Sorry, let me try to take a quick look at the time here. But yeah, that's sort of a bit more of what I'm trying to just, like I mentioned earlier, of just hearing a lot of those voices, because I know sort of my pathways and some of my barriers that I've experienced, and I want to hear more of those different experiences in different communities. And like I always mentioned, that I'm just sort of one lived experience, and then yeah, I know there's a lot more that do happen in different areas. And so it's great that I'm finding more and more people and communities to work with. So it's finding a good network, and that's what I'm always trying to do, is try to find other Indigenous researchers, Indigenous healthcare workers, and then also people living with a disability, and try to connect a lot of those dots, as I know I've got a lot of assistance for me to succeed throughout my life. And so I'm glad, hopefully I can connect a few of those dots for any other peers coming up in the near future. And yeah, I guess I guess we can sort of end there. I just want to thank everybody for allowing us to come out and say a few words and share some of our experiences with you guys today. And then I guess if we've got some time for any Q&A.
Well, thank you very much, Davina, Emily, and Richard. This has been really interesting presentation, and I myself personally learned a lot. I have to apologize, we run a little bit over the time, but I really wanted to hear your all thoughts. We have one question, so maybe I'll just quickly read the question. I also put this in the chat, so if anyone would want to take and maybe just quickly answer, that would be great. I also, apologies. I also encourage all participants to connect with our speakers online or in person if you're at the conference, and you might have a more extensive conversation. So a quick question that we have here is, in efforts to truly put patients first, how can we shift from decentralized department-based funding of language services to centralized system-level funding for trained professional interpreters and translators? What evidence or policy levers are needed to discourage reliance on untrained bilingual staff and instead institutionalize professional language access as a core component of patient safety and equity? Does anyone want to briefly answer or just make a comment?
Such an easy question. It's always a challenge, because even that's what I talk about within BC. Just in BC alone, there's over 200 different bands and reserves. So even just working within different languages within BC, that's a huge challenge there. That's why I was talking about, I think Emily brought it up too, whenever we go to different communities, I always try to pool, any of the community involvement with a community elder, and to come in and welcome us in a traditional way within each different culture, in each different region. And so, because I know that's always the biggest challenge is just everybody, especially with SCI care, that, I learned that back in the 70s, and I had a lot of racism within my spine doctor back then. I don't think I was seen as a person. And so I know, not that it was a language or that was one of the biggest barriers, but them seeing me as a person. And so I think that's the biggest thing is as you mentioned, trying to normalize, like it's just healthcare. I mean, and within you living within Canada, that should be free and available and safe for everybody. But I know as a minority and growing up with a disability that is, not fully true within our community. So I think it's great that we're moving more towards a safer spot. But I know it's always, even for me, that I can't solve a lot of those questions or any concerns that do arise. But even just sharing my story too, just saying, here, I have lived through it also and survived and succeeded. And so I think that sometimes just even hearing some of those stories, they're going, all right, I can do this. I can, live and have a good quality of life, whether it's sports or get back to work or even just with family and culture. And so, but that's the biggest thing of trying to, close that gap and make sure that it is safe and everybody gets a bit more knowledge with everything that's available to them, provincially and nationally. Hopefully that answers a bit.
Thank you so much, Richard, for answering such an easy question. But truly sharing your journey and showing us humility. It's been really great to hear your story. Thank you so much, Davina and Emily.